Hi everyone, today we will be discussing granulomatous conditions of nose and atrophic rhinitis. In this picture you can see a granulomatous condition of nose that has grown to such an extent that has reached the oropharynx and the oral cavity. And what is that condition? It is one condition which is seen endemic to South India, especially Kerala and Tamil Nadu, and it is associated with dip bath. So it is routine to ask any patient who come with history of epistaxis for a history of dip bath because this condition is endemic here. But nowadays the incidence of this condition is coming down. Still, the people who had got infected with this condition early on are coming with history of recurrences. Now, what is this condition? Yes, it is none other than rhinosporidiosis, and this rhinosporidiosis is seen in India, Sri Lanka and Pakistan. In India, it is seen more in the Kerala and Tamil Nadu. So it is seen in the South India. Okay. And what is the etiology behind the condition? Rhinosporidiosis is caused by Rhinosporidium seabri. Okay, Rhinosporidium seabri. What is it? Is it a fungi or a protozoan? It was considered as a fungi. Okay, but now it has been reclassified as a protozoan. Okay, Rhinosporidium seabri has now been reclassified as a protozoan of the class Mesomycetozoa. Okay, so rhinosporidiosis is caused by Rhinosporidium seabri. It is now part of Mesomycetozoa. Now, what are the clinical features? The patient will be presenting with recurrent epistaxis. Okay, recurrent epistaxis, and the thing is, this thing rhinosporidiosis grows in the nose slowly and it causes nasal obstruction, and when it obstructs the nasolacrimal duct and it can even grow into that area, it can result in epiphora. Okay, and when the granulomatous this rhinosporidiosis comes out of the nose, it will have the typical appearance of a polypoidal pinkish mass, and it will appear like strawberry. Okay, it will appear like strawberry, and it will have the white dots. White dots are seen in the red fleshy thing. Okay, there will be white dots here, and these white dots are the sporangia. Okay, these are the sporangia. So you have sporangia as white dots in case of rhinosporidiosis. It has been asked for the exam, that's why I have been repeating. Okay, so strawberry appearance is seen associated with rhinosporidiosis. It is also called as mulberry appearance. Okay, it is not the unripe mulberry. Unripe mulberry appearance is seen associated with hypertrophic turbinate, right? The ripe mulberry appearance, as you can see here, this one. Okay, ripe mulberry appearance is seen associated with rhinosporidiosis. It can also extend into the oropharynx, nasopharynx, oral cavity, and even larynx. Okay, it can even extend into the larynx. The first laryngeal rhinosporidiosis was reported by a great ENT surgeon from Kerala. Okay, Dr. O.S. Radhakrishna Prasad. He is from Trivandrum Medical College. So laryngeal rhinosporidiosis also can occur, but it is rare. Of course, it is rare. And yes, this is how it appears, just like a strawberry which is embedded with sporangia forming the white dots, or the mulberry. Okay, mulberry appearance. Both are right. Okay, and it can even extend into the oral cavity, into the throat. Okay. Now, coming to the life cycle, it is initially seen as a trophozoite, and then it grows slowly to form the sporangium, and from the sporangium develops the endospore, and these endospores gives rise to the free electron bodies. And in this sporangium development itself, there are immature sporangia, then intermediate sporangia, and mature sporangia. Okay, mature sporangia. For undergraduate exam, it is asked in Kerala, Tamil Nadu, the southern states of India. Okay, but for NEET PG entrance also it can be asked as a spot. So it is important that you learn about the condition rhinosporidiosis. Okay, rhinosporidiosis. This is how it appears. Okay, when a biopsy is taken, when you examine that area, but it is not usually indicated. Biopsy is not usually indicated. If you simply take a nasal smear, you will be able to see the sporangia associated with the condition. Now, what is the treatment of this condition? The problem with this condition is that whenever there is trauma and there is a mucosal abrasion in that area, these sporangia can get embedded and it can grow and spread. Okay, so what has to be done? You have to do a wide excision of the rhinosporidiosis. Okay, and for that, endoscopic wide excision, because it is seen within the nose. Initially, what used to be done before the advent of endoscopes was by looking through a Killian speculum, it will be just pulled out like that, and because of that, because of the trauma, it will get embedded in all the areas where there was trauma. Okay, and that is the reason for a lot of recurrence in this condition. The sporangia, when it gets attached to that area, it will cause regrowth of the condition. Okay, so such has been the recurrence rate of this condition that once a great ENT surgeon joked that when you are doing a rhinosporidiosis surgery, just make sure that the other side, the rhinosporidiosis has not started growing back by the time you complete one side. Okay, because such was the recurrence of that condition, and the reason was the rudimentary extraction technique that was practiced earlier on. But nowadays, with the advent of endoscope, you can do an endoscopic wide excision with cauterization of the base. The cauterization of base is very important. Okay, because otherwise in that area where the pedicle has been attached, there will be regrowth. Okay, so that's about rhinosporidiosis. Rhinosporidiosis is the most important granulomatous condition of nose that you have to remember, and it is very distinct from the other granulomatous conditions which I am going to discuss now. Okay, the first one I will be talking about rhinoscleroma. It has nothing to do with rhinosporidiosis, and it is totally different in the epidemiology point of view because it is seen in North India instead of South India, and this is a condition which is caused by bacteria which is called as Frisch bacilli, and the bacilli is Klebsiella rhinoscleromatis. Okay, that is why it got the name rhinoscleroma. Okay, so don't confuse rhinosporidiosis with rhinoscleroma. Both of them are having entirely different pathology as well as epidemiology. Okay, it is of course a chronic granulomatous condition, and it has got 3 stages of development. What are they? First of all, it is having the atrophic stage, when it will show features of atrophic rhinitis, about which I will be teaching you soon. Then you have the granulomatous stage. Okay, that is why it is a chronic granulomatous condition. Okay, so after the atrophic stage you have the granulomatous stage, and finally you have the stage of cicatrization. Okay, so these are the 3 stages which are seen in case of the rhinoscleroma, and epidemiologically, as I already told you, it is seen in North India. Okay, as opposed to rhinosporidiosis seen in South India. Here it is seen in North India, and etiology is by Frisch bacilli or Klebsiella rhinoscleromatis. Okay, Klebsiella rhinoscleromatis. Now, what are the clinical features? First of all, in the atrophic stage, you will have features of atrophic rhinitis. What are they? There will be a lot of crust in the nose. Okay, crusting in the nose. And then when granuloma formation occur, it results in Hebra nose deformity. Okay, Hebra nose deformity. It is also called woody nose deformity. And finally, with cicatrization, the patient will undergo a serious change in the nose, and that will result in the Tabir nose deformity. Okay, Tabir nose deformity. So, Hebra nose and Tabir nose, they are both associated with rhinoscleroma. And what is this? This is Hebra, right? Hebra nose deformity is seen in the stage of granuloma. Okay, the stage of granuloma in case of the rhinoscleroma, whereas Tabir nose deformity is seen in stage of cicatrization. Okay, stage of cicatrization. So, these are the various stages and various clinical features associated with the Klebsiella rhinoscleroma. But how will you diagnose this condition? It will be like any other chronic granulomatous condition, right? You will have to take a biopsy for that. Okay, when you take a biopsy, what are the features that are specific of rhinoscleroma? In rhinoscleroma, when you take a biopsy on histopathological examination, you will be able to see that there are macrophages that are having the Frisch bacilli engulfed within it, and the cytoplasm will be foamy cytoplasm. Okay, that is why it is appearing empty like this. Okay, and these cells are known as Mikulicz cells. Okay, Mikulicz cells. So, this Mikulicz cells have foamy cytoplasm, and along with that bacilli will be present. Okay, there will be bacilli within the cytoplasm. Okay, and this is what is called as Mikulicz cell. And along with that, another specific feature is the Russell bodies. Okay, Russell bodies are seen within the histopathological examination slide. And what is this Russell body? It is a specific type of plasma cell with eosinophilic inclusion bodies. Okay, with eosinophilic inclusion body. And why did I keep this picture? If you remember, this is a great Sri Lankan player called Russell Arnold. Okay, Russell Arnold. So, to remember the name Russell bodies, I just kept this picture. Okay, plasma cell with eosinophilic inclusion bodies. Okay, so Russell bodies and Mikulicz cells are the features of rhinoscleroma. And how will you treat the condition? Yes, in the atrophic stage, you can do saline douching and everything which are needed for the treatment of atrophic rhinitis to remove the crust. Okay, but to treat the condition, you will have to go for antibacterial drugs. And what are the antibacterial drugs that are used? Streptomycin along with tetracycline is the mainstay of treatment. Okay, but second line drugs include rifampicin and ciprofloxacin. Okay, you can use Dexona to reduce the inflammation. Okay, dexamethasone to reduce the inflammation may be used to reduce edema, and the patient may need to undergo plastic surgery. Rhinoplasty may be needed to correct the deformity which has been already formed. Okay, for that you will need to undergo surgery. So that's all about rhinoscleroma. Now coming to one condition which is now disappearing, and what is that? It is syphilis. It has already disappeared with the advent of antibiotics, but in the 60s, 70s and even 80s it was one condition which was a great mimicker of all diseases, and what is that? It is syphilis. Okay, syphilis can be congenital, and in congenital syphilis it is known as snuffles. There is a catarrhal stage. Okay, snuffles. It will present with rhinitis. Okay, snuffles presents with rhinitis. Okay, it is seen in the catarrhal stage. Okay, syphilis also can bring about chancre in the primary syphilis. Okay, chancre will be present and it will be painless like chancre elsewhere. Okay, secondary syphilis presents with snail tract ulcers, but it is rare in the nose, but still it can occur. Okay, snake tract ulcer, remember secondary, S for S. Okay, snail tract ulcers are seen in secondary syphilis. Now what will you see in tertiary syphilis? You will be able to see gamma. Gamma is seen in tertiary syphilis. Okay, gamma is seen in tertiary syphilis.